Wonderful. Hello, everyone, and welcome to the From Vaccine to Vaccination webinar series taking place all this week. This is the second day. So welcome back to those that have joined us in the previous two webinars so far that have been part of the series. This morning, we talked to Dr. Catherine Duggan, and then yesterday we talked to Dr. Dean Smith. So the replays for those events, in case you missed them, will be available at the end of this week. Now, my name is Rola Kaakeh, and I'm the CEO of Salus Vitae Group, and I will be the host for the event today. Now, at this point in time, we're all waiting on the COVID-19 vaccine. The speed at which the vaccine clinical trials have been conducted, reviewed, and approved is unmatched in history. It's truly unlike anything we've seen before. If you've been following the news this morning, you can see in the UK, they've started administering the COVID-19 vaccine. But on the brink of this new vaccine, an enormous challenge awaits us, and that is the distribution and administration of the future COVID-19 vaccine. We are not only now focusing on the vaccine, but on the whole vaccination process. Therefore, we're discussing from vaccine to vaccination. Now, as part of this week-long series, we're very lucky to have 6 leaders from across various settings share their experiences, explore recommendations, and propose actionable strategies as we all prepare for the deployment of the COVID-19 vaccine, wherever we are in the world. These leaders come to us with diverse backgrounds and expertise. We heard from a health economist yesterday. We have several vaccine experts. We have executives of global organizations representing millions of pharmacists. We have deans of both school public health and of pharmacy. We have an informatics administrator, as well as we also have a clinician that's actually implementing the strategies discussed on the ground. Now, like I've mentioned, we've already spoken to 2, and so be sure to watch those when those are available. Now today, over the course of this hour together, we ask our guest speakers a number of questions. I will start with the questions, and then we leave about 10 to 15 minutes towards the end where we open it up for audience questions. So please, I encourage you at any point to add your questions in the Q&A box, and we will get to them when we open it up for audience questions. We also encourage you both during and after the event to post any takeaways that you have from the event in the Q&A box or on various social media platforms and tag us at Salus Vitae Group. We love hearing how you benefited from the insights that our speakers share, but we also hope to pass those along to others. Now, the session today will be recorded and is available for replay after the event, and you will get notified when those recordings are available. Now, I am pleased to introduce and welcome our guest speaker today, Dr. Michael Hogue. Michael is the Dean and Professor of Loma Linda University School of Pharmacy in Loma Linda, California. Much warmer than it is here in Chicago. Michael was on the staff development team and an original national faculty member for APhA, or the American Pharmacists Association's Pharmacy-Based Immunization Delivery National Certificate Program for Pharmacists, which over 350,000 pharmacists and student pharmacists have completed since its inception in 1996. He continues to be actively engaged in immunization policy and advocacy, as well as education of nurse practitioners and physicians in disease prevention through vaccines. He has conducted several studies in the area of vaccine implementation through pharmacies, as well as he's also written dozens of manuscripts and monographs related to vaccines and vaccine preventable diseases, and speaks frequently around the globe on the subject. He was the first pharmacist in the state of Alabama to administer vaccines in his pharmacy practice in 1997. He also serves as the 165th President of the American Pharmacists Association through March of 2021, and is the immediate past Speaker of the House of Delegates of APhA. APHA's House of Delegates is often referred to as the profession's policymaking body, as representatives from all US states and territories, as well as all national pharmacy organizations and federal government branches, are seated together with APHA's current leadership to set policy through the APhA House. Perhaps the greatest accomplishment of the House during Michael's tenure as Speaker was the passing of significant policy directly addressing pharmacy safety, and as well as the workforce and resilience needs of pharmacists to assure optimal wellness within the profession, and thus optimal patient care. In July, he was one of the 45 healthcare professionals appointed by the Centers for Disease Control and Infection, or the CDC, to an advisory committee on immunization practices work group on the COVID-19 vaccine. So as you can see, we truly have an exceptional speaker with us today to cover all the topics that we have planned. So welcome, and thank you so much for taking the time to be with us today.
Well, thank you, and I appreciate the invitation, and I'm looking forward to the conversation we have here.
Okay, so let's just jump right in. So today, yes, so we have a rich conversation planned, and we go within the various webinars. We've had several themes that we've been consistent with. The first one is talking about some lessons learned and strategies, and then we'll also start talking about workforce requirements and preparations for that. We will touch on equitable access, and of course, the role of communication and addressing misinformation in general. We will also then begin to conclude by talking about various stakeholders and then some advice moving forward. So today, we have a lot to talk about for sure. So the first question is, what have we learned thus far from the current and previous pandemics and vaccines that will prepare us for the COVID-19 vaccine?
Well, it's a great question. I mean, obviously our past experiences shape our planning that we make for the future. I think that one thing, when I look back at the past and previous pandemics, the most recent pandemic, which obviously paled in comparison to COVID-19, was the H1N1 pandemic. And we learned an awful lot about national emergency vaccination programs through H1N1. Primarily, we learned about what did not work. There were a lot of things that didn't work very effectively, especially with implementation of the vaccine and the rollout of the vaccine into clinical practice. By the time the vaccine actually got to market with the H1N1 vaccine, the consumer demand for the vaccine had dropped off substantially. And there wound up being an awful lot of doses of H1N1 vaccine that went wasted. Now, that's not to say that it wasn't an important vaccine or that vaccinating patients wasn't an important thing to do. It was. In fact, vaccination did mitigate the pandemic back when we had the H1N1 pandemic. But we learned an awful lot about how we should better use community resources. And so I think that's what we're seeing happen right now with the COVID-19 vaccine planning that's going on with the CDC, and with Operation Warp Speed and the federal government's approach to the vaccine this time, is that they're actually going to the community engaged pharmacists first and not waiting until the end to get pharmacists involved. They're looking to have pharmacists involved from the very beginning because they know that members of the pharmacy profession are located in more zip codes in the US than any other, and in more rural and urban communities than any other professional. So they want to leverage that access that pharmacists provide to be able to get the vaccine into arms as quickly as possible.
That's awesome. I think that the point that you also made about the demand, the supply and the demand, we're thinking right now a lot about the supply because there's very large demand right now for the COVID-19 vaccine. But I think it's also interesting to see the time that will veil. Right now, there's this spike in demand and how that will project over time, because we're not going to get everyone vaccinated within the first month or 2 or 3, right? And so I think that's actually, as you're saying, it will be very interesting to see that change, or it might continue, might increase, just depending on the strategies that we have in terms of communicating the benefits and need of the vaccine. So that is great. Now, we know that the pharmaceutical supply chain is very global. We depend on countries outside of the United States, where both of us here are in the United States, but our audience is quite global. So many countries depend on each other for different elements of the pharmaceutical supply chain. But now, as we look to the COVID-19 vaccine, because even that we're getting the vaccine from different places, do you think that such a global pharmaceutical supply chain can withstand this global demand that we have right now for the vaccine?
Well, first of all, let me just reference your viewers and listeners to the World Health Organization. They created a document probably published about 3 months ago on a globally equitable approach to vaccine supply chain distribution and availability of vaccine globally. So if any of your listeners are interested in reading up more on that, I would really reference them to the WHO's guide for that, because there is a framework that's in place. And I think the vaccine manufacturers are working diligently with governments globally to try to address supply chain issues. You know, there are literally dozens of vaccine candidates that are under investigation worldwide, and certainly there are priority pre-purchasing that's being made by governments that have lots of fiscal resources to be able to afford to pre-purchase vaccines. And so that's often driving a lot of the conversation about where vaccines will go first. But I think that there are supply chain issues. It's very interesting. Just this morning, late yesterday, there was breaking news in the U.S. that the U.S. wanted to buy more of Pfizer's vaccine, and Pfizer doesn't have any available to sell to the U.S. Pfizer's already signed contracts with countries outside of the U.S. And so the soonest that the U.S. should expect to get any additional doses beyond the 100 million that they had already purchased is probably next June or July, according to the news sources. So it just illustrates that the manufacturers do have a lot of pressure. I do think there are going to be challenges. There are going to be ethical challenges. There's also going to be healthcare system challenges within some countries that don't have necessarily as great of a workforce, a healthcare workforce, to be able to administer the vaccine. I mean, I think of places like India, for example, one of our most populous nations on earth, also is one of our most under-resourced nations on the planet in terms of healthcare providers to provide the vaccine. So we need people in India should expect to be vaccinated and have access to the vaccine just the same as people in the US or Europe expect to be able to have the vaccine. So I just use that as an example. But yeah, the supply chain issues are definitely going to be a problem. And as you well know, the Pfizer vaccine has some special and unique issues related to storage and handling that make it particularly problematic. And then the additional added layer of complexity to that is that the two mRNA vaccines that are coming to market first both require 2 doses in order to fully protect and immunize the individual. So the supply chain has to not only be able to get the initial dose to the right country in the right place, but then the supply chain has to be able to follow up at either 3 weeks or 4 weeks, depending on the product, later with a second dose just in time to be able to immunize that individual with the second dose. So again, those are some complexities with the supply chain I know that are being tackled globally, and it'll be easier to do that in some countries than others, but certainly logistics will be quite an amazing thing if it's pulled off successfully.
Well, the point even too about the supply chain being able to supply that vaccine within the time period of the second one. Catherine was talking about earlier this morning too about the workforce being prepped and also ready, so that you basically, after that 3 weeks, if you vaccinate the first one, you vaccinate again, you need that workforce to vaccinate the second time, but then they're also still vaccinating other people. So it's kind of like that double, but you also have to think about supply chain. Like if you don't get to that second dose in time, you have to have enough at least to be able to vaccinate, give the 2 doses to that one person.
That's right, and I think that can't be underestimated by your listeners. I think, pharmacists have been, especially community-based pharmacists in the U.S., have been thinking a lot about the vaccine, and pharmacy technicians have now been authorized to administer vaccine with appropriate training. And of course, student pharmacists are eager to administer vaccine as quickly as possible. I love the energy of our students. That's great. But exactly as Catherine said, it will get progressively, the workload is going to progressively increase. as we move on, because there'll be very limited quantities of vaccine initially coming into the market. Most of those doses are going to go directly to hospitals to immunize the frontline healthcare workers who are dealing with COVID positive patients, and to long-term care facilities for nursing home residents, where we see our largest death rate occur in the United States is in long-term care facility residents. And it'll take probably about 4 to 6 weeks before we'll have enough supply in the market to be able to offer a vaccine to all of the people who qualify under the current 1A guidelines of the ACIP. And so you're looking at about a 4 to 6 week period of time for those people. And then immediately thereafter, we'll start jumping into these other high-risk populations, which are much, much larger. I mean, we're talking about 21 million healthcare workers in the United States. But if you look at the essential workers that are not healthcare workers, that's about 58 million people. And those people will be next in line, and the 65-year-olds, which is another 40 to 60 million people in the US. So the numbers are going to go up, up, up in terms of how many need to be immunized. And so those second doses will be coming on, and we still have this huge demand for first doses. And of course, I don't want to jump too far ahead here, because I know we'll talk about the research on the vaccines maybe just a little bit later. But I believe when today the Pfizer study results became public and are now available on FDA's website for the phase 3 clinical trial. And the study shows very decisively that the vaccine is highly effective at preventing SARS-CoV-2. Over 95% efficacy, regardless of age population, for people over age 16. And that's pretty remarkable. And there were no serious adverse events that occurred with any statistical frequency above placebo in any population whatsoever. So a very safe vaccine as well. And now that that information is out and becomes more public, I think what's going to happen, Rola, is the demand is going to really shoot up even higher than it has been. There's been some hesitancy. Now that we have data and we actually have the scientific evidence to back the vaccine, I think the demand's going to go up. So yes, pharmacists are going to have to really be on their toes and ready. This is going to put a major strain on our pharmacy system in the US to be able to immunize all these people.
Yeah. Actually, I know we were meant to talk a little bit about that later, but actually let's talk about it more now in terms of the studies that have been done for the vaccines and the fact that this data is actually really great. I was reading an article previously how now the expectation is like it's 100% effective, although we know with vaccines, I mean, getting this high is like really good for vaccines. But when we even look at the populations, for example, like we're starting to think about the populations that this vaccine was tested in versus now the population, which is essentially over time the whole world in a way, but which is very diverse. Are the trials representative of all the diversity that this vaccine is projected to like help assist with, or?
Well, I just want to show your viewers here that I actually have a printed copy. I'm still a little old school, so I still have a printed copy of the 91 pages of data that Pfizer submitted to the FDA, and we'll have the same size document I expect in about a week for the Moderna vaccine. And here's what I want to say about that. No clinical study is perfect, okay? But I will tell you these are very well done. And here's a couple of things that I'm impressed with. So if you look over the last 20 years at all of the phase 3 studies that have been submitted to the FDA for approval of a vaccine of any kind, the number of people enrolled in those phase 3 clinical trials varies from 5,000 on the low end to 65,000 on the high end. The average phase 3 clinical trial for a vaccine that was submitted to the FDA in the last 20 years had 27,000 enrollees in the study. The Pfizer BioNTech study had 44,000 individuals in that study. The Moderna study has, and we'll see the final numbers, but somewhere around 30,000 people in the study. Both trials enrolled more patients than the average study for a vaccine that's routinely come to market during our normal processes. So no one needs to be concerned about the power of the study. The study's power from a statistical standpoint is very, very solid and very good. Second thing is I want to address the issue of ensuring that these studies are representative of the US population. There's always been concerns in studies that there was an overrepresentation of Caucasian study participants, healthy study participants, and most studies do a pretty good job of representing male and female in the studies, but sometimes that's been a real concern. So the Pfizer study that we've just been able to take a really close look at as of today nationwide shows that there were about 9.4% of the study enrollees were Black or African American. And in the US population, about 12% of the population is Black. So it's pretty close actually to being representative of the African American population. The 28% of the study population is Hispanic or Latino or Latinx, if you want to use that terminology as well. And that's actually about 10% more than the US population, which is 18% Hispanic. So there's a little bit of oversampling of the Hispanic population in this study. The Asian population in the study is just about 4%, and that's about the amount that the percent of the population that is Asian in the US. So the bottom line is this study is constructed and designed to be roughly reflective of the US population, and the data actually bears that out. And I'm very pleased to say, and I've read through the data now a couple of different times and looked at sub-analysis that's been performed by others, there are no differences in the efficacy or the side effect profile of the vaccine in any subpopulation. The efficacy is strong and remains strong even in the oldest of the old, which we sometimes get concerned about because as we age, our immune system naturally begins to decline, and we would expect our response to a vaccine would decline as well. But you know, again, we only have 2 months worth of data or so out of this study, but the early data shows that even the older patients, the people who are over age 70 and older, even they had a strong response to this vaccine, a very positive sign that we might be able to bend the curve and stop this pandemic if we can get vaccine into people's arms, because as we all know, the people who are over 70 are more likely to die if they contract SARS-CoV-2.
So that's a good transition to actually one of our questions regarding the reporting of any adverse events. So this, of course, has the whole track from the whole clinical trials now to approval and then now to vaccination is happening very, very quickly. And although, like you had mentioned right now, the data is very promising, it is very good, there's always a tracking system to ensure that if there's any adverse events and as we learn about the vaccine over time. What have you seen in terms of tracking systems that have been implemented? Have they been implemented on an institution or a national or a local level? What have you seen from that? And what can we learn as we begin to think about setting up our own tracking type of systems?
Well, I would encourage your listeners to check out the vaccine safety on COVID-2 on the CDC's website, because they've gotten quite a bit of great information there that I think will give more detail for those who want it. But I will share with you that there's a pretty extraordinary coordinated effort at the federal level underway to be able to do post-marketing surveillance related to these vaccines. And first of all, the manufacturers are closely tracking the outcomes. One of the things that's happening with this vaccine that's very different from past vaccines is that every single dose of vaccine that's administered has to be recorded in a federal tracking program. So that means every pharmacist gives a dose. That dose is going to be recorded in the state-based vaccine information system, immunization information system, or people call them registries. We previously only used those for kids, but not anymore. Now we're using them for adults, and with SARS-CoV-2 vaccine, we're going to really be giving them the test, because every single dose must be entered into those registries. Pharmacists won't be allowed to administer doses if they can't agree to put the doses in the registry. So that's important, because as individuals then report that they have adverse events, we'll be able to track by lot number, by exact place where they received the vaccine. The provider will be able to track all the way down to the individual patient level anything that happens with these vaccines. We've never had the ability to really do that down to the individual vaccine recipient. So that's one big thing that's happening. In terms of safety monitoring, however, there's a tremendous system underway of safety monitoring. One is a vSafe app that patients will be provided access to. So when you receive your SARS-CoV-2 vaccine, you'll be given a little paper record card by your healthcare provider that will say that you've received a dose, on which date and which vaccine you received. Then you'll be able to go to the vSafe app on your phone, download the app, input your information yourself. It will give you a reminder in either 21 or 28 days, depending on which product you got, as to when you need to come back for dose number 2. But it will also ask you to record any adverse events that you're experiencing in real time. And so then the CDC and FDA will be able to look at that data and be able to see if the adverse events that are happening in real time, I mean, literally in real time, that's amazing, are occurring as we expected them to occur, or if there are safety signals that we need to be alerted to that occur in larger populations. So, and I'm just barely scratching the surface. To be honest with you, we could do an hour on the federal vaccine safety process. But this just gives you a little bit of insight into the extra and special efforts that the government and the manufacturers are going to make sure that they're tracking safety and making sure that people are safe with this vaccine.
So that actually brings me to the next logical question. And you've been in this space for a long time. Like, do you think we're going to do this for other vaccines? Why didn't we think about this before? I mean, this is wonderful, and I'm just beginning to think about all of the other vaccines that we could do this for. What do you think? What do you think about that? Will we start doing it for other vaccines, or this is a one-hit wonder?
I think there's a lot of things we're learning with this pandemic and the rollout of this vaccine that will help us improve our system in the future overall. Being able to recall people back for vaccine doses using these app-based technologies will be very helpful in the future with series dosed vaccines. There's no question about that. I do think that this will revolutionize our system in terms of the way we track for adverse events and so forth going on. Everything is really important. At this time, I've never seen a group of people come together in such a coordinated manner to pull something off the way this vaccine has come together. I'm so impressed. And I realize that, the vaccine thing has gotten political in the US because of the presidential elections and everything. But, folks, we got to set that aside, set politics aside, and look at the science here and look at what's happened. And it's extraordinary. The way that the career FDA and CDC people have pulled together, the way the manufacturers have pulled together, state and local jurisdictions, and there's 64 local state level jurisdictions in the U.S. 50 states, about 6 major cities, metropolitan areas have their own health jurisdiction, and then the federal jurisdictions. And you add all that together, you're talking about an awful lot of people who have to be very coordinated to make something this sophisticated work. And then all the way down to the provider level, where you have hospitals and health systems and pharmacies that are all connecting together and saying, we're going to do this. We're going to stop this pandemic. It's extraordinary. I mean, every moment that it happens, we want the next day to come because we want to get this pandemic over with. But boy, the lessons learned and the documentation, we're all going to have these stories to tell our children and grandchildren that are just going to be amazing, you know.
I agree. Like, that's the one thing I keep thinking about. It's incredible how people have come together and thought about how to solve this and how to begin to address all the challenges. And the only thing I keep thinking about is like, can we do this for something else as well? Like, we have all of these other health conditions. Let's work on that, because it's
I
very
know.
exciting, right? Like that was how we're able to get this so quickly and do things so quickly, right? Where we brought together all these great minds to start thinking about how do we solve that. So I'm very happy that you're as excited as I'm excited. And I actually also loved how pharmacists truly stepped up during this, especially with the in preparation for the vaccine as the most accessible healthcare provider, but as a profession too that are very well versed in being able to administer and talk to the communities about this. So
yeah, and I had a chance on Friday last week to be a part of a meeting with Dr. Redfield, who's the head of the CDC, Dr. Collins, the head of the NIH, and also Dr. Hahn, who's the head of the FDA. And this particular call had members of course, they're all appointees of the current administration. Dr. Collins goes back for several presidential administrations, but the Biden transition team was on the call, and also the presidents of other national health-related professional organizations. I was there representing APhA. And the reason I bring this up is that I was asked to give some comments on behalf of the profession of pharmacy relative to the response. And I gave my remarks, and Dr. Redfield of the CDC was effusive with praise for the profession of pharmacy and for pharmacists in general for really having stepped up in the public health response. And he expressed the deepest gratitude to the profession of pharmacy for really being a partner, a true partner with the CDC and trying to address this pandemic. And I just have to tell you, there were only about 3 pharmacists in the room. I felt a tremendous sense of pride, and I felt so good about our profession that we really have stepped up. I mean, you use the right words. We've stepped up, and we've proven that pharmacists, to coin a phrase, are indispensable in our society.
Yes, and for sure. Thank you also. Like APhA has a number for those, because we're talking also to the audience. You guys have a number of resources regarding COVID in general, but definitely as we prepare for this. So they've been a wonderful resource in general. I think ever since I've been in pharmacy, they've always also been my go-to for a lot of resources, but they've been great as well. Now, we've talked about kind of the traditional quote unquote, where you could get a vaccine, what we've traditionally seen in terms of a pharmacy, a health center, the hospital or health system. Are we going beyond the walls of these traditional settings to vaccinate? What have you heard, or what have been your experience thus far about?
Yeah, I think that's a great question, and I think it's going to evolve over time. So with the Pfizer vaccine, because it requires the -70-degree storage, we're probably going to be tethered to more traditional locations for the administration of that vaccine, because we just can't maintain the cold chain and keep the vaccine cold enough. So we probably will have pretty traditional models of administering that vaccine, especially early on. But as we move into the Moderna product, which can be stored for up to 30 days in a normal refrigerated temperature, and then coming on the heels of the Moderna product are 2 additional products that are different technology. But AstraZeneca has a vaccine, and Johnson & Johnson has a vaccine, both of which we should be seeing come to market by February, somewhere in that neighborhood, assuming that their trials are also successful and show good efficacy and safety. So, those vaccines are different. There's single-dose vaccines that don't require 2 vaccines. Those are refrigerated vaccines purely. And I guess what I would say is that I think as there are, different vaccines will have different capabilities in terms of where we might see vaccines happen. I think we could see vaccination occur literally anywhere. I think that if we can put armies of people together to get vaccine out, I think the push is to try to get vaccines into as many places as possible. I think there's a strong commitment on the part of public health officials to try to ensure that every community, every single community in the U.S., whether rural or urban, whether remote or easy to access, that everybody has access to this vaccine, and they're doing everything within their power to be able to find the mechanisms to get those vaccines. I mean, the person who lives in Barrow, Alaska, you have to take a dog sled to get there in the winter months, and they should be able to get access to this vaccine just as easily as someone who lives in downtown LA. So I think that's what they're working hard to try to do, and we should expect an extraordinary effort. It's going to be an extraordinary circumstance that's going to be outside of anything we've ever seen before. And I'm so excited to see pharmacists and pharmacy techs and student pharmacists stepping right up and saying, okay, where do you want me to go? I'm ready to do it. And I think that's pretty exciting.
Yeah, we're definitely very proud. So many of our attendees and those that are preparing for the vaccine, I've started to think about the different campaigns or initiatives or processes that they're starting to do. But when you think about that, do you start thinking about specific outcome metrics that would help you deem whether something was successful or not? Or how do you start to think about whether a specific campaign or initiative might be working or not working? And how do you kind of evaluate those?
Well, that's a great question, but it's also full of lots of curves. Let's say in a road to success, there's a lot of curves along the way. The difficulty here in being able to know what exactly does success look like is that vaccine is going to come in very small quantities initially, and then it's going to expand, and we hope that'll be a very rapid expansion. I mean, it's possible that it might not be. It all depends on the supply chain. Everything comes back to the supply chain. But I think initially our success metrics are going to be whether or not the American people accept the vaccine. And so we start with healthcare workers. Healthcare workers cannot hesitate. It is essential. And I understand that healthcare workers have had the same concerns that all Americans have had about whether these vaccines have come to market too fast and whether what's the issue. But I think the science is there, and healthcare workers have got to step up and show the rest of the country, since we're first in line to get vaccinated. We have to show the rest of the country that yes, we believe in this vaccine strategy. We're going to get immunized. If we don't, then we should not expect the American people to get vaccinated. They won't. And what does that mean? Well, we know that we need to have at least 80% of our population vaccinated in order to stop the pandemic, to end the pandemic and create good herd immunity against SARS-CoV-2. I can't wait to get to 80%, but the first measure of success is getting healthcare professionals to say, yes, I'll be vaccinated. And that is really, really important. If we can't get that right, the rest of the success metrics are going to be very difficult to achieve as we go along.
I like that in the sense that it also ties in with building public trust, so that you're doing where you're vaccinating your healthcare providers and those that are on the front line, but as well as that underlying tone of you're building the public trust and those that will communicate the importance and significance of it in order to then, it also becomes kind of like a phased communication strategy in a way to build that trust, which is really great. I do want to ask, so we're having several questions come in, so we'll just ask two more brief ones on our end with regards to the issue of workforce. So you have extensive experience in terms of training pharmacists, pharmacy students, and now as we train technicians to meet this need, are there other strategies or specific strategies to build up the workforce in order, the enormous so much workforce, there's so many individuals that are needed to distribute, store, and administer. Are there specific strategies that you can recommend to those listening as they begin to think about building their capabilities?
Well, first of all, I think it goes without saying that we have a massive shortage of pharmacy technicians in our country right now. That's become acutely obvious in the last couple of weeks. I mean, several large national chain pharmacy organizations and hospital pharmacy organizations have announced that they need to hire thousands of pharmacy technicians. And I know pharmacists say, well, why are you not hiring pharmacists? Well, they are. They're also hiring a lot of pharmacists to be able to help. But obviously, if you can get a pharmacist to be able to supervise a team of technicians and take that team out, you know, it's sort of like the attending physician model in a hospital. There's one attending physician, and there might be 6 or 7 resident physicians that are working with that attending over a period of time, and then multiple medical students that are working within a hospital. It's the same thing. Pharmacists should think of themselves as attending pharmacists. You're ordering and prescribing the vaccines. You're overseeing student pharmacists and pharmacy technicians that are administering vaccines in the community. We can access and reach a lot of people. I think in terms of long-term workforce development, you know, there's a lot of people in our country that are unemployed right now. Becoming a pharmacy technician is not an extensively onerous process. It does take some training and some time. We need to start engaging people that are on the unemployment ranks now in thinking about a career as a pharmacy technician. My hope would then be that many of those people who are pharmacy technicians, as the pandemic begins to wind down, begin to think about a possible career as a pharmacist. And furthering their career plans in pharmacy. So I'm hoping that through the pandemic, we can actually build a pipeline of healthcare professionals and expand the reach of pharmacy, because I do believe that the demand for pharmacists will go up after the pandemic because the new roles of pharmacists are beginning to take root. And I think our payment systems and healthcare system is going to start paying pharmacists more directly for their non-dispensing clinical care services as we move forward. And I think that demand for pharmacists is going to go back up.
Great. I love that perspective in terms of seeing it as this team with the pharmacists and the technicians and the students, and then seeing where you can build capabilities and build that pipeline where we have shortages and that we ultimately also need in order to better build out our systems, allocate time to better patient care. I think there's so many ripple effects to what you're saying in terms of building those capabilities, which is great. So we have several questions, but just one more before we get to, which is some advice or final thoughts that you have for those that are preparing for the vaccine that we haven't already mentioned.
Well, you know, it's sort of this hurry up and wait thing right now. You know, pharmacists just want to get in there and do something. And we all hear that the vaccine's coming, the vaccine's coming. Okay, when are we going to get it? How are we going to get access to it? So I would just say, be patient. When the Pfizer vaccine, assuming that it gets approved under emergency use authorization by the FDA later this week, and ACIP is holding an emergency meeting on Friday to consider specific recommendations related to the Pfizer product. Given those assumptions, we'll expect that next week the first shipments of the Pfizer vaccine will arrive in the States, and we'll start immunizing healthcare providers. Again, those are going to almost exclusively be people that are working in hospitals on COVID units and directly in emergency departments with COVID positive or potentially positive patients, and it's going to be long-term care facility residents. Be patient. There will be enough vaccine for everybody, and that includes pharmacists, pharmacy technicians. Anyone who works in a pharmacy is included, is considered a healthcare worker. Doesn't matter if they're doing the housekeeping, or if they're the clerk at the front counter, or if they're a pharmacist or tech. Everybody in a pharmacy is considered a healthcare worker. So there will be enough. It's just going to take about 4 or 5 weeks for that to happen. But just be ready. Do everything you can to prepare yourself. Think through the processes that you're going to use to be able to document. Make sure that your pharmacy is connected to the state's immunization registry so that you can easily interchange data. Be sure that you've executed your contract with your wholesale buying group. If you're an independent pharmacy or if you're a regional chain, they will have already connected up with the CDC to be able to receive doses. And then, another step you can take proactively is to identify which patients in your databases will meet those early criteria, so that you can notify them that vaccine is available. And the one other thing that I would mention is that there is a federal website, a resource called Vaccine Finder, and you can just Google Vaccine Finder. And when the COVID vaccine becomes available and is shipped to specific locations, each day providers will enter into Vaccine Finder the number of doses that they have remaining. Now, that's important because what that will do is it will help consumers be able to identify where they can actually go and get a dose of vaccine, rather than with futility driving around trying to find the vaccine. They'll actually be able to go to Vaccine Finder, and they can tell within a 100-mile radius of their home where vaccine exists, then they might be able to get that vaccine. So make sure you're set up for that. And so those are just the proactive things that you can do. And if you don't mind me promoting it, every Thursday I do a live broadcast webinar for pharmacists on the COVID-19 pandemic. And tomorrow, or this Thursday, we'll actually have a CDC representative. We're just talking about the vaccine on Thursday, and that's also for continuing education. But we do this either weekly or every other week, depending on the amount of information that's coming at APhA, so people can go to pharmacist.com and then look at the COVID-19 resources to connect to that weekly webinar.
Yeah, the resources you guys have are absolutely wonderful. So yeah, I definitely recommend for anyone interested. And you've provided so much in terms of resources and things that we can consider and look for as well. Okay, so we have several questions that have appeared in the Q&A box. The first is there any information on how long immunity lasts with Pfizer and the Moderna vaccine?
Yeah, that's a great question. Not yet. I mean, the data that was submitted to the FDA for the EUA has 2 months of follow-up. So, we don't have enough time yet. The only thing I would say is just yesterday, Dr. Francis Collins, the head of the NIH, did post his weekly blog. And in his weekly blog, the NIH has done a antibody persistence study for healthcare workers who've been infected with COVID. And what they discovered is that the healthcare workers that were infected with COVID early in the pandemic, January, February, March, that they have shown that their antibodies have persisted at highly protective levels even since that time. So we know that the human body does maintain high antibody levels post-infection. Now with vaccine, we'll have to see if that persistence is there. I will tell you that both the Pfizer and Moderna vaccine studies, the phase 3 studies, will last for a total of 2 years. So they'll actually monitor antibody titers in this study participants for a full 2 years. And we'll know, but it's going to take time. We won't know anything for sure about persistence until we get time under our belts.
And there's another question that kind of ties with that about speaking how long that it will take for those that get vaccinated to build immunity. My understanding, it says in this question, this is the person asking, my understanding for at least Pfizer is that you have to have the booster before reaching immunity.
Yeah, that's yeah, so great question. So let me explain just a little bit more about this, because I think this is an important concept to get. So it is a 2-dose primary immunization series. Technically speaking, the second one's not a booster. The second dose is actually part of the primary immunization. Now, as you'll see in the Pfizer data, and I can't quote the exact statistic off the top of my head because there's a lot of data in that study, but as you'll see in the Pfizer data, if you want to go look at the study, you can do that on the FDA's website. there were a fair number of people who actually were protected and did not develop infection. So the rate of infection was lower in vaccine recipients even after one dose. So if you look at the number of infections that occurred in people after one dose versus after two doses, clearly it was 95% effective at preventing infection after two doses, two primary series doses. But there was a reduction in infection after just one dose as well. But we really want to reach the highest amount of immune protection that we possibly can. So the two doses is what we know will give the immune system the best response and give us the highest antibody titers. The second thing that's kind of related to this topic also is how long does it take before you build immunity? Well, they've monitored patients 7 days following vaccination. So with most inactivated vaccines, we say it takes 2 weeks or longer to develop an immune response. But with the SARS-CoV-2 vaccine, we believe only about a week after you've received the vaccine, you'll begin to have protective antibody titers. So much quicker with this vaccine to get protection underway. And so the study protocol actually looked at rates of infection 7 days after the second dose. And that's how they got the 95% confidence, or the 95% effectiveness with the vaccine, was looking just 7 days after that second dose. That's a great question.
Yeah, they're really good. Another question is by an attendee. She said that this person said that I just updated my vaccine tracker today and couldn't find any suggested time for AstraZeneca or Janssen to be available. Is there a specific place that I can find that information? P.S. Absolutely all my information in this tracker is fluid and just to keep track of the latest information. So where can we go for the latest, or is there multiple places that you go to get that information?
Well, yeah, I think that there's a couple of things that you can do. I mean, the NIH does keep people pretty well informed. Dr. Collins, through his weekly blog, if you don't subscribe to the National Institutes of Health's director's blog, I would encourage you to do it. Francis Collins is a brilliant mind, a brilliant research scientist, and very, very trustworthy. He's been at NIH for my entire career. I don't know how much longer than that, but for a long time. And so I would just encourage you. That's a great place to get that information. And he keeps everybody in the U.S. pretty informed when the trial data is available. Based upon the latest information that's been released publicly relative to the J&J and AstraZeneca vaccines, we expect the AstraZeneca vaccine probably will be the next one that will have an EUA request. We think the timing for that, based on publicly available information, will be somewhere around the end of January. Which means that vaccine might be available as early as the end of January or early February. And the J&J vaccine, I think, is a timeline that's maybe 2 or 3 weeks behind that, so maybe mid-February. But again, those are estimates. They're not hard and fast things, but I think that that's the best thinking currently is that's about how long it's going to take before we see those vaccines come to market. But I mean, the bright side of that is that by the time spring break rolls around, everybody kind of thinks about spring break in March and April. By the time that spring rolls around, we should have 4 vaccine products and easily, could have 300 or 400 million doses of vaccine. That would be enough vaccine to ensure that everyone in the U.S. who's at high risk would have been offered a vaccine maybe by the end of April. And it's possible that by the end of September next year, that every American, period, who wants a vaccine will have been given the opportunity to have a vaccine. So I really do think we see the end of this pandemic coming. I really think that there's a real possibility that 2021 will mark the end of the pandemic. We're just going to keep holding our breath, I guess, to some extent, and vaccinate away and vaccinate as quickly as you can, as many people as you can. And that's what it's going to take to get it done.
And actually, have there been also studies, as we're thinking about this too, with the first dose being maybe a Pfizer vaccine and then a second dose being another manufacturer's vaccine? Will we start seeing those types of studies in case?
Yeah, that's a great question. I mean, these vaccines are not interchangeable right now, and so you won't be able to do that initially. I doubt seriously that there will be any studies anytime soon on that, just simply because right now the focus of the science is to make sure that we have efficacy and safety data for the entire population. So for example, the Pfizer's emergency use authorization that went forward was for 16 years of age and older. Well, the next phase is to be able to study children, people from 12 to 16 years of age, and then children less than 12 years of age. And we don't have any studies yet even underway for children less than 12 years of age. There is a small study going on with 12 to 16-year-olds. But I think that there's going to be more focus on how we expand the population that can receive the vaccine safely and effectively prior to doing any kind of interchangeability studies. And of course, as I said earlier, there's at least 6 different platforms or mechanisms by which the vaccines are being developed currently. I wouldn't expect that we'll ever be able to interchange among the platforms because they all work so differently in the human body. Is it possible at some point in the future that that could change? I doubt it. I mean, I really don't think we'll ever see much interest in interchangeability.
Thank you for that. These have been really great. We'll just take one more question because we only have about 2 more minutes, but can you just briefly talk about the cold chain being preserved as we distribute the vaccine internationally?
Yeah, that's obviously a bigger problem in some places than it is in others. I mean, I think about, I had a call this morning with some colleagues in Mozambique, and Mozambique is a very under-resourced country. Very few healthcare resources and financial resources are very, very low in Mozambique. And I think about how vaccine will get there. I mean, there's definitely going to need to be a prioritization of the vaccines that have the greatest ability to have temperature variation to go to those sites. And so all of the manufacturers are doing temperature variation studies, all of them. And so they're all looking at what's the widest temperature range that we can maintain efficacy of the vaccine and stability of the vaccine product. And I think the manufacturers see that it's a really high priority because there are so many nations where storage is going to be a real problem and getting it there. So I would say stay tuned to that. I think there will be a lot of great solutions. The WHO is really, really interested in this topic, as you might imagine. And of course, a lot of the sub-Saharan African countries are keenly focused on this right now. And so that's something that there's been a lot of time and energy put into to try to examine. Yeah, stay tuned on that. It's very, very important. I did see one other question I wanted to just address before we wrap up, and that is about the use of personal protective equipment. We're likely going to be in a situation where we need to continue to wear masks all the time, probably for at least another year and maybe another 2 years, because we need to be confident, 100% confident that those people who have weakened immune systems and who cannot build their own immunity have protection against the deadly virus. So I would expect that masking is going to be more of a cultural norm. It's going to become more of a cultural norm over the next 12 months as we intensify our vaccination efforts. I don't anticipate that there'll be any change, especially during localized outbreaks. I don't anticipate there to be any major change in the public health recommendations, even once we have a vaccine well into the marketplace.
Yes, thank you for that, for addressing that question there. So thank you so much for such a wonderful session. There was so much information, not only provided during this session, but there's also so much information on where to go for reliable information, which I think so many of us are also looking towards, because there's a lot of misinformation out there. So that has been absolutely wonderful. And I do recommend for everyone to continue to check out the resources provided by trusted sources, by APhA, and then continue to hear from Michael during these sessions that they do regarding updates on the COVID-19 in general and the COVID-19 vaccine. But on behalf of Salus Vitae Group and myself, I would truly like to thank you for taking the time today to be with us and sharing these great insights with us. We do have a few more people in the webinar series, so if you haven't already done so, please go to our website, salusvitaegroup.com, to register for the remaining events. They're also going to be wonderful, so we're really looking forward to them. Thank you again for joining us, and we hope to see you at the next event.
Thank you. Bye-bye.
Thank you.